Thank you very much for this opportunity to talk about the latest advances in cancer care. I'm Dr. Sarah Easaw, practicing as a hematology and oncology specialist in Ocean County, New Jersey. A little background information about myself. I did my medical education in Kerala, India, and had postgraduate medical training in the US. I did a 3-year fellowship in hematology and oncology at New York Medical College in Valhalla, New York. After completing my training, I have been practicing as a specialist. In 2005, I started a Center for Cancer and Blood Disorders in Lakewood, New Jersey, called Ocean Hematology and Oncology. In this center, we take care of patients with various cancers and many different types of blood disorders, such as anemia, bleeding disorders, and blood cancers. Currently, I'm affiliated with the RWJ BHMG medical system. It is the largest multi-specialty physician group in New Jersey, affiliated with the Rutgers University. The landscape of cancer care has evolved tremendously over the course of the last few decades. Historic records show that the disease cancer has been around for thousands of years. In 1937, Fortune magazine wrote, "Thus, for 3,000 years and more, this disease has been known to medical profession. And for 3,000 years and more, humanity has been knocking at the door of the medical profession for a cure." There is evidence that there were surgical procedures done to remove unwanted growths from the human body more than a century ago. The deeper knowledge about cancer, its origins, various risk factors that lead to cancer, and understanding the genetic changes involved in the development of cancer have all helped in better managing this disease. Once notoriously viewed as a death sentence, cancer is now considered a chronic disease such as diabetes or high blood pressure. Let us look at some statistics. Cancer is among the leading causes of death worldwide. In 2018, there were 18.1 million new cases and 9.5 million cancer-related deaths worldwide. By 2040, the number of new cancer cases per year is expected to rise to 29.5 million, and the number of cancer-related deaths to 16.4 million. And generally, cancer rates are highest in countries whose populations have the highest life expectancy, education level, and the standard of living. But for some cancer types, such as cervical cancer, the reverse is true, and the incidence is highest in countries in which the population ranks low in these measures. Approximately 39.5% of men and women will be diagnosed with cancer at some point during their lifetimes. Even though the incidence of cancer is rising in the United States, the overall cancer death rate has declined since the early 1990s. This improvement in outcomes for cancer patients is mainly due to the research advances in early detection, screening, as well as better treatment options. Identifying the risk factors and taking measures to prevent them will help to reduce the incidence of cancer. Cancer can be caused by a variety of factors. Some risk factors can be controlled. Choosing the right health behaviors and preventing exposure to certain environmental risk factors can help prevent the development of cancer. Smoking, poor nutrition, physical inactivity are just some of the human behaviors that have been linked to the development of many common cancers. Smoking is one of the most preventable causes of cancer. Smokers are at risk for developing lung cancer, cancer of the throat, oral cavity, larynx, bladder, liver, pancreas, and many more. This is in addition to the risk of getting lung disease, heart disease, strokes, and hardening of blood vessels. Smoking causes at least 30% of all cancer deaths in the United States. Avoiding tobacco use is the single most important step people can take to reduce the cancer burden. Other important lifestyle factors that can be modified to reduce the risk of cancers include dietary habits, decreasing the consumption of dietary fat, red meat, and processed meats, increasing physical activity, reducing direct sun exposure, using HPV vaccine that protects against the cervical cancer are all measures to reduce the risk of cancer. Early detection and screening also help to diagnose cancers at an early stage where a cure is possible and thus reduce the likelihood of dying from cancer. Examples of screening measures include the use of Pap smear in diagnosing cervical cancer, use of screening mammogram to diagnose breast cancer at an early stage, using colonoscopy to screen for colon cancer, and to remove polyps that can later lead to cancer, etc. There are guidelines in place to be followed at certain ages for these screening tests. An ounce of prevention is much better than a pound of cure. If the above risk factors can be controlled and the screening guidelines are followed, the risk of dying from cancer can be significantly reduced. There are also certain genetic factors that predispose one for cancer. Inherited genetic mutations play a major role in about 5 to 10% of all cancers. Researchers have associated mutations in specific genes with more than 50 hereditary cancer syndromes, which are disorders that may predispose individuals to developing certain cancers. Identifying these genetic mutations has helped to identify the family members at risk and to guide them through early detection and preventive measures. Examples of such cancer genes include the breast cancer gene, BRCA1 and BRCA2, commonly known as BRCA1 and BRCA2. Having mutations in these genes will increase the risk of breast, ovarian, and other cancers. Family members of patients with BRCA mutations can be informed about their higher cancer risk and can take advantage of appropriate risk prevention strategies. There has been also great progress in cancer therapy in the last few decades. Oncology is the field of medicine where the most significant research progress has been made in recent years. Hundreds of new medicines are approved every year, and many more are in the pipeline. Surgical techniques have also been modified and fine-tuned to make the least invasive procedure for the most benefit in curing cancer. For example, up until the 1990s, most women with curable breast cancer needed a mastectomy, that is, surgical removal of the entire breast. Initially, the mastectomy also included removal of the surrounding muscles and lymph nodes, resulting in a huge deformity and risk for swelling in the arm. But later, research has shown that the same therapeutic results can be achieved by doing a lumpectomy, which is removing the cancer and surrounding area, sparing the rest of the breast, and sampling 1 or 2 lymph nodes rather than taking out the whole content of the axilla. These results have led to a significant improvement in the management of breast cancer while giving better cosmetic appearance. Advances have also been made in the type of chemotherapy used for different cancers. Chemotherapy drugs are designed to kill cancer cells and slow down their growth. Most chemotherapy drugs have side effects as they can affect normal cell growth as well. In the 1970s and 80s, there were only a handful of chemotherapeutic agents available, and they were used in different combinations and doses for most cancers. Now there are hundreds of chemotherapeutic agents, specific protocols for each cancer, designed for the stage and biological features of the cancer cells. Chemotherapy has also evolved from a one-size-fits-all approach to a plan that is tailored towards the individual patient. There are certain features on the tumor cells that define the response to therapy. The chemotherapy protocol that is used for 2 different patients with the same type of tumor may be different based on these characteristics. Genetic changes or mutations are key in the development of some cancers. Identifying these and targeting them with antibodies that inactivate these mutations have led to destruction of the tumor cells. This discovery led to the advent of targeted therapy for cancer. A major breakthrough in cancer therapy and a major example of targeted therapy is the treatment for chronic myelogenous leukemia, commonly known as CML. There is a genetic change called the Philadelphia chromosome that causes CML. Drugs that target the genetic changes that lead to the Philadelphia chromosome have been identified, and they have been very successful in curing this type of leukemia. In the past, the only hope for cure for CML was a bone marrow transplant. Now, 95% of patients with CML are cured by taking a pill orally once a day. This remarkable progress in cancer therapy has extended to other cancers as well. Now we have targeted agents that act on specific mutations in patients with lung cancer, breast cancer, colon cancer, and a variety of other malignancies. Last but not least is immunotherapy. These are a group of medicines that stimulate our own immune system to fight cancer. The immune system in our body is working hard to prevent the formation of cancer cells. When there is a disruption of this process, it will lead to accumulation of abnormal cells that lead to cancer. Immunotherapy drugs help to restore this defect in cancer patients and help to fight cancer. Immunotherapy is found to be beneficial in many cancers, including lung cancer, cancer of the head and neck, and melanoma. Cancer research is evolving rapidly, and the treatment that is recommended today may not be the standard of care a few months from now. The struggle does not end here. The war against cancer is continuing and will not cease until a complete cure is possible for all cancers, or until we can come up with ways to nip cancer in the bud before it begins. Until then, we have to educate ourselves to take measures for risk reduction, do the necessary screening tests for early diagnosis, and get help immediately at the onset of symptoms. I'm very happy and honored to play a small role in the global fight against cancer. I want to thank all of you for your attention. I'll be happy to answer any questions related to this topic. Thank you.
Thank you, Dr. Easaw. That was very informative. And I mean, I felt like I sat through a class because of all the details that you walked us through. And we all know that cancer is the second leading cause of death in the US. And there are many kinds of cancer. But like Dr. Easaw said, there are cancers that can be prevented and also that can be detected early. So we had a few questions that came through during your presentation. I'd just like to go through each one of them. The first one asked was, at what age should people start focusing on cancer screening for early detection?
Screening is different for different kind of cancers. The most common cancer among women is breast cancer. So breast cancer screening typically should start at the age of 40. This age should be younger if there is a strong family history of cancer, especially there are family members who were diagnosed at an early age. Screening should start at either at 30 years or 10 years before the youngest age of the person who had cancer in their family. That's for breast cancer. And the screening for breast cancer is by doing a mammogram. And different organizations have a different guideline for mammogram screening. Some recommend screening from 40 years onwards annually, and then maybe it can be switched to biannual when you reach 65. The other important cancer to think about in the younger population is Pap Smears, and that has to be started when in the reproductive age in your 20s. And colon cancer is another cancer that screening has been found to be effective. The screening for colon cancer includes colonoscopy, and that should be ideally starting at the age of 50. Again, if somebody in the family had colon cancer at a younger age, screening should start 10 years prior to that age. A 40-year-old gets cancer with of the colon, the family members should be starting screening at 30 years, and so on and so forth.
Okay. So how do young children then as old as 5 years get cancer?
So that's cancer in children is a whole different topic, and that comes from genetic mutations. So the environmental factors or risk factors that we just heard about, smoking or dietary habits, has nothing to do with the development of cancer in children. And most of the cancers may not even have a risk factor that we can point out to why one person had cancer. Usually in young children, the most common cancer is leukemia. And leukemia comes from a mutational change that happens inside the bone marrow. Some kids may be born with genetic changes that can predispose them to the development of either leukemia or other cancers. So these are not environmental factors, these are genetic defects. And for some reason, there is no way we can predict these things in young children. But it's unfortunate. But the good thing about leukemia in young children is that the treatment has been improved a lot, so that about 80 to 90% of kids with acute leukemia have a chance for being cured. But the risk factors that we mentioned do not apply to them.
Okay. And we have one more question, and the question is, how does immunotherapy work when compared to other cancer treatments?
Our body has an immune system that fights cancer. Because normally our body has a tendency to keep on dividing. So if that is left unchecked, everybody will develop a lot of cells in your body that leads to cancer. So there is a balance where our immune system constantly check the production of these cells. There is something called programmed cell death or apoptosis, where as much as the cells are made, they're also dying. So that the product there is no abnormal growth of the cells leading to cancer. So when cancer happens, there is disruption in this process. So the immune system will fail to check the process of excessive growth. So immunotherapy medications that acts at the level of the immune system to kind of wake up this immune system, so that our own immune system can fight the division of the cancer cells. That is, like, in a nutshell, the basis of immunotherapy. So what happens is, when our immune system is awakened or like probed to make to be active to prevent the cancer's growth, then it can also cause immune changes in other parts of the body too. So immunotherapy can cause other side effects from having a flare-up of an immune reaction. But most of the time, we are able to manage the side effects effectively. And immunotherapy has been found to be very effective in certain cancers. It is still being tried in many cancers, but the benefit of immunotherapy has been in specific types of lung cancer and cancers called malignant melanoma, which is cancer of the skin. Those are the areas where immunotherapy has been very effective. But a lot of research is going on with immunotherapy in other type of cancers and identifying who will benefit at the molecular level, who will benefit.
Thank you, Dr. Easaw. That was very informative, definitely, and you went through the details, and thank you for taking the time to go through this.
Thank you.
If anyone needs any legal advice or consultations or have any further questions, you can please visit their website, which is www.oceanhemonc.com, and you can schedule an appointment with them, and you can ask your further questions there. Thank you.